will I talk about today without talking about staph? The famous, or should I call it notorious, staphylococcal infection. Staph is everywhere. You know, a lot of research that have amazed me over the years concerning staph is something that, you know, I cannot even completely exhaust here. I'll just pinpoint some things clearly. You know, like I've always said in my writings, you know, when I do write-ups in the national newspapers, you know, most of those writings I've done have brought about a lot of argument. And most people say to me, this Dr. Paul, you like to talk about stuff, you know, likes to talk about stuff. You know, why wouldn't I talk about the infection that is ravaging our people? Okay, if you say that beyond here, beyond Africa, maybe in Europe or America, they don't talk, they don't even give concern, they don't talk about staphylococcal infection. I can understand it because the level of hygiene over there compared to what we have in some part of Africa is something that you cannot, you can't just keep quiet about. Though staph is not something, it's a microorganism, of course, it's a bacteria. You know, but it's a jam. You can say jam. You know, but you can. It's not the kind of jams. You know, if you have been in the village, you see all these kind of jams. You see in the dirty water. You know, maybe in the dirty drum that has not been washed for a very long time. You know, that have formed mold inside of those kind of water. You now see, you know, this kind of jam. You are seeing them with your ordinary eyes. They are dancing inside the water. That's not the kind of jams we are talking about. Staphylococcal infections they are bacteria, they are germs, but ordinary eyes cannot see it. It can only be seen through the use of microscope in the medical laboratory. In fact, even when you do certain analysis and probes, you know, it takes you about 2, 3, 4 days for the thing to show up, for you to really know the seriousness about what staphylococcal infection. But in some places, they take it, they treat it with a kid's glove and take it as if it's not a subject to be discussed. Is this okay? Of course, analysts in their research have said, well, how do you know? How does this thing get inside the system? They've said, okay, there is no the bacteria is only looking for open place, a open part of the body to get into the system and cause havoc. For instance, it's believed that some researchers believe that if it goes through the nose into your system, is a problem. If it finds its way also through an open wound, maybe you have a cut on your hand and the thing penetrates and goes through your bloodstream, you know, it becomes a problem. You now begin to take antibiotics for many years. And you keep taking antibiotics. Some of them you take and get some relief. After a while again, the thing will show up. It can ravage. It can affect. If that kind of infection, staphylococcal infection for what it is, if it affects a man and affects a woman who are both married, if this couple are not have not had issue and maybe they are new couple, then you see them they enter another level of, you know, serious issue in their life, trying to take several kind of antibiotics to fight. I'm telling you out of experience because I have consulted for many years. I've talked to people who have had these infections. But what are we saying? It's not something that one can say, well, it is only through hygiene. It's a bacteria. It's something you cannot see through your eyes. It's so micro, it's so small. It gets into your nose, it finds itself into the system. According to research, it gets into your bloodstream through an open wound on your system. It begins to cause havoc. So from research, you know, we have taken time anyway. Organic formulas, you know, are very, very effective. There are research that have been conducted in some part of South America. Part of those have that are researched and documented in certain medical encyclopedias. Some of them in my writing now. You see me putting a whole number of experts that I've admired over a very long time about their writings about stuff and certain herbs, documented herbs, not just anything you see around. You say this is herbs for stuff. I'm talking about documented formulas, part of which we have composed in our formulation of a formula we call Bartolin. You know, I know the testimonies I've had concerning this formula. You know, Bartolin, you know, and a number of other things, depending on our discussion, I can recommend that you take, that they can really fight and get rid of this infection. It's not something that cannot be cleared from your system. It's not a viral infection. It's not a virus. It's a bacteria. But depending on the approach and how it is handled, you can actually get out of your system. So call me. Let's talk about it more. You can come out of stuff. Thank you.